Vitamin B12 is a superstar nutrient. It's essential for your body to function at its best. From creating DNA to keeping your blood cells healthy, B12 plays a vital role. Without enough B12, your body can really struggle. Think of B12 as the Energizer Bunny of vitamins. It keeps your cells powered up and ready to go. It helps make red blood cells, which carry oxygen throughout your body. Without enough oxygen, you'll feel tired and run down. B12 also plays a crucial role in your nervous system. It helps maintain the protective covering around your nerves, called myelin. This covering is like insulation for your nerves, allowing messages to travel quickly and smoothly. But here's the catch. Your body can't produce vitamin B12 on its own. You need to get it from your diet or supplements. And as you age, absorbing B12 from food becomes trickier. This is why understanding B12 deficiency is crucial, especially as we get older. Let's dive deeper into the incredible ways B12 supports your body. Imagine your DNA as the instruction manual for your cells. B12 is like the essential ingredient that allows your cells to read and copy this manual correctly. Without enough B12, DNA synthesis goes haywire, potentially leading to serious health problems. Now let's talk about red blood cells. These tiny cells are responsible for transporting oxygen throughout your body, giving you energy and keeping your organs functioning. B12 is a key player in the production of red blood cells. When you're deficient in B12, your body can't make enough healthy red blood cells. This leads to a condition called anemia, where your tissues and organs don't get enough oxygen. B12 is also a mood booster. It helps produce serotonin and dopamine, chemicals in your brain that regulate mood and sleep. So if you're feeling down or having trouble sleeping, a B12 deficiency could be a contributing factor. As we age, our bodies go through many changes, and unfortunately, absorbing B12 becomes more challenging. Here's why. B12 needs a special protein called intrinsic factor to be absorbed in your gut. As we get older, our stomachs naturally produce less intrinsic factor, making it harder to absorb B12 from food. Think of it like this. Imagine intrinsic factor as a key that unlocks the door for B12 to enter your bloodstream. With age, we produce fewer keys, making it harder for B12 to get where it needs to go. Certain medical conditions, like atrophic gastritis, can also damage the stomach lining where intrinsic factor is made, further hindering B12 absorption. Medications like proton pump inhibitors, commonly used to treat acid reflux, can also interfere with B12 absorption. This age-related decline in B12 absorption is why it's crucial for older adults to be mindful of their B12 intake and talk to their doctor about potential deficiencies. A vitamin B12 deficiency is a global health concern, and statistics paint a clear picture of its prevalence. In Western countries, studies show that up to 20% of adults over the age of 60 are deficient in vitamin B12. In Russia, the situation is equally concerning. Research indicates that B12 deficiency affects a significant portion of the population, particularly older adults. While specific numbers may vary, it's clear that B12 deficiency is a widespread issue in Russia. Several factors contribute to this widespread deficiency. Dietary habits play a role, as many people don't consume enough B12-rich foods. As mentioned earlier, age-related changes in digestion also contribute to the problem. Certain medical conditions and medications can further increase the risk of B12 deficiency. It's crucial to be aware of these risk factors and take steps to ensure adequate B12 intake. Section 5. Fatigue and tingling. Could it be B12 deficiency? Feeling constantly tired and experiencing strange tingling sensations in your arms and legs? These could be signs of B12 deficiency. Remember how B12 is essential for red blood cell production? When you're deficient, your body can't make enough healthy red blood cells to carry oxygen efficiently. This lack of oxygen can lead to fatigue, making you feel like you're dragging yourself through the day. The tingling sensation, known as paresthesia, occurs when nerves don't receive enough B12 to maintain their protective myelin sheath. Imagine your nerves as electrical wires. The myelin sheath acts as insulation, allowing electrical signals to travel smoothly. Without enough B12, this insulation breaks down, causing signals to misfire, leading to tingling, numbness, or even pain. If you experience persistent fatigue and tingling, Don't ignore these signs. Consult your doctor to get tested for B12 deficiency. Section 6. Depression. Is B12 the missing link? Feeling down, unmotivated, or experiencing mood swings? While these are common symptoms of depression, did you know that B12 deficiency could also play a role? B12 is crucial for the production of neurotransmitters like serotonin and dopamine, which regulate mood, sleep, and appetite. When B12 levels are low, these neurotransmitters can become depleted, leading to mood changes, depression, and even anxiety. Think of B12 as a mood booster. It helps keep your brain chemistry balanced and promotes feelings of well-being. Studies have shown a link between B12 deficiency and an increased risk of depression, particularly in older adults. If you're struggling with depression, it's essential to address any underlying nutritional deficiencies, including B12. Section 7. Megaloblastic anemia, a telltale sign. One of the most striking consequences of B12 deficiency is a condition called megaloblastic anemia. This type of anemia occurs when your body can't produce enough healthy red blood cells due to a lack of B12. But here's the interesting part. In megaloblastic anemia, the red blood cells that are produced are abnormally large and immature. These oversized cells, called megaloblasts, are unable to carry oxygen effectively, leading to a range of symptoms. Imagine trying to inflate a balloon that's too big for its own good. It might look impressive, but it won't fly very well. Similarly, these oversized red blood cells can't navigate the tiny blood vessels in your body efficiently, leading to fatigue, weakness, and shortness of breath. Megaloblastic anemia is a serious condition that requires prompt medical attention. If you experience any symptoms of anemia, such as fatigue, pale skin, or shortness of breath, consult your doctor immediately. Section 8. Beyond fatigue and tingling, other signs to watch out for. While fatigue and tingling are common signs of B12 deficiency, other symptoms can be more subtle and easily overlooked. Pay attention to any changes in your body, no matter how small they may seem. For example, have you noticed that your tongue looks smooth and shiny? This condition, known as glossitis, can be a sign of B12 deficiency. B12 deficiency can also affect your balance and coordination. You might feel unsteady on your feet or experience frequent stumbling. Vision problems can also occur, with blurred or double vision being common complaints. Some individuals may experience memory problems, difficulty concentrating, or even personality changes as a result of B12 deficiency. It's important to remember that B12 deficiency can manifest in various ways. Section 9. Diagnosing B12 deficiency. Don't ignore the signs. If you suspect you might be deficient in B12, don't ignore the signs. Early diagnosis and treatment are crucial to prevent long-term health problems. The good news is that diagnosing B12 deficiency is relatively simple. Your doctor can order a blood test to measure the levels of B12 in your blood. This test is usually done in conjunction with other blood tests to rule out other conditions that may cause similar symptoms. Be sure to tell your doctor about any medications you're taking, as some medications can interfere with B12 absorption. Your doctor will also ask about your medical history, diet, and lifestyle habits to determine the underlying cause of your deficiency. Remember, early detection is key to preventing complications from B12 deficiency. Section 10. Treatment and prevention. You have the power. The good news is that treating B12 deficiency is usually straightforward. For most people, taking B12 supplements orally is enough to restore their levels. In severe cases, your doctor may recommend B12 injections to rapidly increase B12 levels in your bloodstream. These injections are usually given in a doctor's office or clinic. Prevention is always better than cure, and when it comes to B12 deficiency, there are simple steps you can take to ensure adequate intake. Include plenty of B12-rich foods in your diet, such as meat, poultry, fish, eggs, and dairy products. If you follow a vegan or vegetarian diet, talk to your doctor about taking B12 supplements to meet your needs. Section 11. Live your healthiest life. Embrace a B12-rich diet. Living your healthiest life starts with nourishing your body from the inside out. Embracing a B12-rich diet is a simple yet powerful way to support your overall health and well-being. Load up on foods like salmon, tuna, beef, chicken, eggs, milk, yogurt, and cheese to boost your B12 intake. Fortified breakfast cereals are also a great source of B12, especially for those who don't consume enough animal products. If you're concerned about your B12 levels, talk to your doctor about incorporating a B12 supplement into your routine. Remember, taking care of your health is an investment, not an expense. By prioritizing your B12 intake, you're giving your body the essential nutrients it needs to thrive.